Compare and contrast. Today, we learned that the state of Kentucky has a surplus of COVID vaccines. Kentucky's governor said his state received more than 200,000 vaccine doses from the federal government last week. But because not enough people signed up for appointments, 42% of them went unused. Now let's compare that with the situation in Michigan. Michigan is currently experiencing the worst coronavirus surge in the country, with more than 9,000 new cases reported just yesterday. And the state is actively trying to acquire more vaccine doses in the hopes of beating back their surge. Last week, Michigan's Governor Gretchen Whitmer asked the White House directly if they would be willing to surge vaccine supplies to her state. Yesterday, one of President Biden's senior health policy advisors says the administration has not ruled that out. Joining us now is Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Dr. Jha, thank you for being here. You're someone who we think of for the advice about what we should do in our homes and in our families. But this is, it would seem, one of the sort of complicated policy questions. And what should the government do? Should the White House be surging vaccine supply to our hotspots?
Yes, Nicole, thanks for having me on. I think the answer is yes, they absolutely should, especially Michigan. Michigan is really suffering right now. They're seeing these huge spikes in cases, driven largely by the variants. And more vaccinations would help a lot. And so I believe the White House should send more vaccines there. They should send more vaccinators, and we should get a lot more people vaccinated in Michigan as urgently as possible.
Can you say a little more about what's going on in Michigan? Because the variants are everywhere. We heard today from the CDC director. Is Michigan an omen of what's to come everywhere? Is it an outlier? Is it under-vaccinated? Just say more about why Michigan is happening.
Yeah, it's a really interesting question. I do think they were among the earliest in terms of widespread variant kind of showing up. So that's one part of it. The other part is that Michigan has actually done very well over the last 4 or 5 months. When the rest of the country was having huge surges, Michigan was not. It was actually under reasonably good control under the leadership of Governor Whitmer, which has the perverse effect of leaving a lot of people still vulnerable. And unfortunately, when B117 arrived in Michigan, I think they just found a lot more people vulnerable. So I think it's a combination of factors. It is potentially what other states will deal with if we don't get vaccinations in good shape. But right now, it's Michigan that's really suffering the most, and they're the ones who need the help.
Some people just recoil, either from skepticism, I think if you're looking at the right of our ideological spectrum, or from fatigue, if you just look at ordinary people, when you talk about a forced surge. What is your point of view on a forced surge? Is it definitely happening?
Yeah. First of all, I think we are seeing a little bit of a surge in a bunch of cases. Again, Michigan is the one where things are really tough, but everywhere else where we're seeing a surge, it's moderate. I think the good news is we're not going to see anything like what we saw over the holidays. And that's largely because we're doing a fantastic job of vaccinating, and we're vaccinating older, high-risk people. So we're not going to see massive increases in hospitalizations. We're not going to see a massive crush of deaths. But we still have probably 3-4 weeks to go before a large chunk of adults are vaccinated. And during that time, we may see a lot of infections and hospitalizations that are unnecessary. If we can kind of keep these infections under control and keep vaccines going.
That's the saddest thing of all. Someone that gets really sick, just if you could have held on a little longer, protected yourself a little longer. Oh, Dr. Ashish Jha, Dean of the Brown University School of Public Health. Thank you so much. It's always great to talk to you.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.